So good morning, everyone, and welcome to our Nelson Talks webinar. I hope you and yours are all safe and healthy at this time. My name is Tony Bartnetti. I've been with Nelson for 23 years, and I'm currently serving as our President of Business Development and Strategic Partnerships. It's my pleasure to moderate today's webinar. When we planned for 2020, I bet none of us thought we would be dealing with the challenges we are currently working through, internally within our organizations and externally with our client partners. I personally did not expect UN words to be in vogue. Unsure, uncertain, unusual, unprecedented, unique, unsettled, unparalleled, unexpected, and united. These are all words that I'm hearing and reading frequently as people are describing their daily work and personal situations. We are in this together. We are learning together. We're adjusting business processes or processes on almost a daily basis and working united to ensure team members and families are safe, while those of us in essential businesses deliver our products and or services to those in need. The Nelson team certainly could not have predicted in February of this year that we'd be hosting a discussion about COVID-19 today, but here we are, and we are truly fortunate to have outstanding speakers here with us today to share relevant information about navigating the environment created by the COVID-19 pandemic. We had a great response to this webinar. As I mentioned, over 700 RSVPs, and we are pleased to have you all join us. Today's topic focuses on navigating COVID-19 as a California business, specifically the challenges it presents in our workplace, the impact on our economy, and to the various sectors of the healthcare system. I want to thank our business partners who participated in our pulse check conversations over the past couple of weeks. We spent a lot of time conversing with you about your well-being and how the new environment is affecting your business. We've learned a tremendous amount from your candid input. Your insights and questions have helped us shape today's webinar. The discussions we've had have been meaningful and have served as confirmation to our team that we're truly in this together. I've got a few housekeeping items, always my favorite part to cover, before we dive into the agenda. The first part of the webinar will include insights from two of our guest speakers, and then we'll move into our panel discussion driven by several questions that came from many of you on the phone and those within our business communities. If you have questions during the webinar, you can type it into the GoToWebinar chat box at any time during the webinar. We've allotted an hour in our initial invite for this webinar, but because of the extreme popularity and the amount of input we've received, we've extended our runtime by 15 minutes. That will be used to answer additional questions, and we invite you to stay on the line if you can, knowing many of you may have a meeting right after this. For any questions we are not able to cover today, we will send out an FAQ document in the days following the webinar. And now I'll introduce today's speakers. Our medical expert is Louise Short, MD, MSc, who joins us from her home office in Atlanta. Dr. Short is the national clinical leader with Strategic Benefit Advisors and Brown & Brown. Using her background in internal and preventative medicine and her experience as an epidemiologist at the Centers for Disease Control and Prevention, Dr. Short advises employers on innovative healthcare strategies to support employees and their families. She earned her undergraduate degree at Harvard and her MD from Tufts University School of Medicine. Welcome, Dr. Short. The next speaker I'd like to welcome is Dr. Robert Eiler. Many of you already know Dr. Robert Eiler, economist, business advisor, academic, and very popular Nelson Talks speaker, who joins us from his home in Sonoma County. Dr. Eiler is president of Economic Forensics and Analytics and dean of the School of Extended and International Education and professor of economics at Sonoma State University. We will round out our speaker panel with Nelson's Vice President of Human Resources, Melanie Wise. Melanie's 20+ years of experience extend across all facets of human resources, including risk mitigation. Personally, Melanie and I have been working closely to support our clients' varied needs during this time and to share the experience we are gaining every day to ensure their employees and ours are working together in a safe environment. She and the rest of our HR team have executed a strategic approach to all things COVID and have provided stellar service to our clients, candidates, and internal team. Melanie, we appreciate your expertise and thank you for your efforts to keep us all informed and compliant. Before we get started, one last thing. I want to share a disclaimer. A lot of small print here on the screen, so I encourage you to read this at your leisure after the program. But let me just give you a Reader's Digest version of it. The information that's being shared today, which will be downloaded after the webinar, and this disclaimer will be in the links. You need to understand that this information is being shared in a fluid and changing environment. What is true yesterday isn't true today. And we only have limited perspective based on the questions that we've been asked. So when we share our answers to those questions, it's important that you contact your attorney, tax advisor, or healthcare professional to obtain advice with respect to any particular legal matter, tax issue, or particular medical question. No participant, user, or borrower of this program should act or refrain from acting on the basis of the information in this program without first seeking that legal, tax, or medical advice that I mentioned earlier. Thank you. Now, I'll virtually hand the mic over to Dr. Louise Short, who will discuss COVID-19 clinical and return to workplace considerations.
Great. Thank you so much, Tony, and good morning, everybody, and thank you all for being here today. I hope you are all well and staying safe. So let's move to the first slide. We are really in unprecedented times here. On the micro level, health has always been tied to financial well-being for individuals. Basically, you protect your income by being able to get up in the morning and go to work. Now we have a very different phenomenon. On the macro level, the health of our nation is putting handcuffs on our economy. Businesses are in a new territory, and in order to understand and manage through the COVID-19 pandemic, business leaders now need to learn a new language and understand and monitor population health trends. I don't think epidemiology has ever been as popular as it is today. For example, leading indicators for depth of disruption of the economy include the time to implement social distancing, the number of cases in the community and the rate of rise, and the geographic distribution of cases, all of which will shift behaviors in spending, activity level, and travel. How long could the disruption last? It depends upon factors including testing, the capacity of the healthcare system, and case fatality rates, which will impact economic factors such as the stock market, unemployment, and other issues. What can we expect in the future, and what is the shape of recovery? We will need to look at controls as we start to put people back into the workplace. We'll be talking about those a little bit later, and as people start to go back to their lifestyle activities. The way that we live, work, and play may be forever altered. As we start to recover from this pandemic, or at least this phase of it, we'll need to be vigilant for early indicators of a resurgence of COVID-19 or a mutated version, or yet a different bacteria or virus that can cause massive disruption of the economy and our lives. To keep the workforce safe and successfully operate businesses, leaders will need to continue to monitor epidemiologic factors and incorporate infection control within their workplaces. So let's move on to talk a little bit about California specifically. On the next slide, there are some numbers related to California. And this, I actually pulled this slide last week because my slides were due, and you can see these are the numbers as of April 17th, but as of yesterday, which was April 21st, there were nearly 34,000 cases of COVID-19 documented in California and 1,230 deaths for a mortality rate of about 3.6%. Over the half the deaths have been in LA County, followed by Riverside, Santa Clara, San Diego, and San Bernardino. California, as of yesterday, had tested about 290,000 people and had about 11.6% positive rate for COVID-19. California was one of the early states to implement non-pharmaceutical controls, including shelter in place. So hopefully that helps in terms of containing the cases and mortality rate somewhat. So let's move to the tools that can help business leaders understand the pandemic. On the next slide, you'll see a model from the Institute of Health Metrics and Evaluation out of the University of Washington. And you've probably seen this model on the news. This is what Deborah Birx and Fauci and President Trump are using. And the data, this is a great website. The data can be drilled down by state. And here we see the projected peak of COVID-19 deaths for California was on April 16th, when there were about 96 deaths. The good news is, unlike New York and some other states, California hasn't really experienced a shortage of hospital or ICU beds acutely, which presumably will lead to better outcomes. What this model predicts, and again, this is changing on a daily basis, excuse me, so is that California can start loosening some of the social distancing after May 18th. I want to emphasize that these predictions are based on current shelter-at-home orders, maintaining social distancing, ramping up testing, contact tracing, and other measures through the end of May. If restrictions are lifted earlier, these numbers and predictions will change. Now, again, normally these types of data are used by scientists and researchers, but in today's environment, it's critical that government officials and business leaders use these data to plan for the future in terms of anticipating issues such as how long will your workforce need to work at home, who and how many employees will need to be furloughed, whether you have enough resources to weather the storm and extend payroll until weeks after the peak passes, or whether you'll have to lay off workers, and if so, when you might be able to start rehiring them. So the big question, of course, and we'll address this on the next slide, please, is when can we get back to normal, and what is normal? Will normal include social distancing and face masks for everyone in public? If we look at California, we're just past spring break and we're moving toward late spring and summer, when kids traditionally would be out of school and families from literally all over the world would flock to California for theme parks and some of the world's most beautiful beaches, among many other attractions. If we look at this graph, which comes from Morgan Stanley Research, we see that we're kind of moving as two countries. There's two peaks in cases. Sort of the east and the west are on one trajectory, the coasts, where the peaks are sort of early to mid-April. And then if we look and we see the rest of the US is sort of peaking late April, early May. So what this research predicts is that there'll be two waves of people going back to work, one in June and one in mid-summer. What we also can see on this chart is a potential resurgence of the virus in the fall. Now, yesterday, there was some news about the CDC director saying that if we have a fall peak, it may even be worse than what we've seen at this point. And they were using some historical data from the 1918 pandemic of influenza, the Spanish flu, where they saw this type of a pattern, and the second peak was actually more severe than the first. So let's talk a minute about testing. As of today, between 4.1 and 4.2 million people in the US have been tested for COVID-19, and about 20% are positive. In order to lift the sort of broad restrictions we're under now and have targeted isolation and quarantining, which is really where we need to go as a society, it's critical that our testing capability be ramped up to effectively identify cases and isolate contacts. So the availability of testing has been a huge issue. And if you look at this chart, what it predicts is by the end of April, which is around now, we should be able to test 500,000 people a day, and by the end of May, 1 million people a day. So I think that may be a little bit overly optimistic, as right now we're having a shortage of test kits and of swabs. So the test is either a nasal, so nose or throat swab. and the swabs are in shortage. There have been other things that have been used like Q-tips, so we'll have to see what happens with testing and whether we can really get to where we need to be in terms of testing and contact isolation. So what do we really need to defeat the virus? Let's take a look at that on the next slide. Everyone really has to do their part and follow public health recommendations and state orders on shelter at home, no public gatherings, social distancing, wearing gloves and masks in supermarkets and pharmacies and other public places. Testing I've talked about for COVID-19, but we also need antibody testing to understand who's been exposed to the virus and what their immune status is. And we'll talk more about that in a few minutes. It's going to be important to figure out who can go back into the workplace safely, but the answers aren't clear on what the antibody testing means. Again, we need robust contact tracing and a public health system that's staffed to be able to perform these tasks. The previous slide showed this capability is ramping up, and sometime mid-summer, the personnel will be in place to perform this function on a wide-scale basis. But this pandemic has revealed the critical importance of funding of our public health infrastructure. Now, over in Asia, there has been some technology that's been developed where using cell phones, you can actually see who has been who exposed to the virus, and there's tracing. Apple and Google are also involved in developing some of this contact tracing that's electronic. The real question is whether that would take off in this country. It's a little bit big brotherish. Certainly it works in the Asian countries, which are a little bit different than the United States. But we here have a lot of concern about sharing data, particularly data of where we are in terms of location, as well as health data. So for now, we're using good old-fashioned contact tracing, calling up people who have been exposed to people who have virus until we can develop better technology and see if people in this country will use it. Two of the primary factors that are needed to defeat the virus are effective therapy and immunization. So there are now over 500 drug trials going on worldwide, and over 90 involve hydroxychloroquine, which is a drug used for malaria and autoimmune disease and has been in the news a lot. I would caution it's not a benign drug. No one should take hydroxychloroquine without the prescription of a doctor. People are trying to get it on the black market, but it has a lot of side effects, particularly for people who have underlying disease and are on other medications. It can cause cardiac arrhythmias, people can die, and they have died. And the results of the studies have been equivocal. It's not really clear that hydroxychloroquine is improving mortality. The good news is last week, results were released from a trial with remdesivir, which is an antiviral manufactured by Gilead. And early results from a small trial of a little bit over 100 people at the University of Chicago showed that people with severe disease showed rapid recovery, and many were discharged within a week, and very few died. This wasn't a controlled trial, so we need more data, but this is probably the most promising information on treatment that we've had so far in this COVID episode. As far as vaccines, there are over 115 in development. Many are in pre-human trials. There are a couple of human trials underway in Seattle and also Atlanta and China. And what we're seeing is that Moderna, which is a company that does vaccine trials and vaccine development, feel that they may have, which would be wonderful, a vaccine to trial wide scale and healthcare workers piloting with them in the fall. So let's hope that that does happen. Okay, on to talking a little bit more about antibody testing. This is almost like the Wild West in terms of antibody testing. There are 4 tests that were approved by the FDA as of this week. There are 50, there are actually now 70 to 90 other companies that have applied for FDA approval. And most of these tests are coming from China, and the accuracy is uncertain. And what's happened is I've gotten a few calls from different clients of mine over the last few weeks that Chinese companies are calling them and trying to sell them directly, these antibody tests. So I think people have to be very, very cautious about anything that is not FDA approved. And even there's even questions about the FDA approved tests and how accurate they are. But these antibody tests, there are a couple kinds. The ones that were approved most quickly are finger stick that can be run in 15 to 20 minutes. It requires a droplet of blood. There's also a couple of tests that require actually a blood draw, so phlebotomy. But the question really is, what do the antibodies mean? There's two types of antibodies. So the first is IgM, which appears sooner after exposure to an infectious agent, and then IgG is a longer lasting antibody that appears later. And what the antibodies really mean is that someone has been previously infected. Now, generally, antibodies do mean or do indicate someone is immune, but it's not always true. So they don't always prevent reinfection or clear a virus. There's sort of a spectrum. And just as an example, people who are HIV infected have antibodies to HIV, but they don't clear the infection. So because there's not enough data, we don't know right now whether people can get reinfected, what the antibodies mean, and how long immunity lasts if these antibodies do confer immunity. What we do know is that SARS, also a respiratory virus, it's also a coronavirus, where we had the outbreak or epidemic in 2009. The SARS virus is genetically related to COVID-19. And what we saw with SARS was that immunity peaked at about 4 weeks, and it lasted 2 to 3 years. So, scientists and physicians now are thinking maybe the antibodies do mean that people are immune for 1 to 2 years, but we don't really know yet. So there are several studies going on. WHO is pulling antibody data from 6 countries. The US CDC is running a study collecting samples in 6 large cities, including New York, Seattle, and Minneapolis. And it brings up a dilemma in terms of what employers should do on testing, which we'll talk about a little bit later. So, let's look ahead to the business recovery phase. And what we see is that the White House released last week these proposed gating criteria for regional and state governments. And the White House has a whole plan called Opening Up America Again, which the URL is on the bottom of this slide if you want to go to the website. So what this criteria really does is it uses symptoms, cases, and hospital readiness to kind of define when state and regional governments can start opening up businesses and schools and such. And so what you see on the symptoms is there needs to be a downward trajectory of COVID-like syndrome cases reported within a 14-day period, and they also include influenza cases as well. And a downward trajectory of documented cases or a decrease in the percent of positive cases for 14 days. Hospitals have to have plenty of capacity to treat people and robust testing for healthcare workers. So that's the gating criteria. I'm going to just say that obviously not everybody is using this gating criteria. I myself live in Georgia, where the governor has, as of today, opened hairdressers, gyms, tattoo parlors and massage parlors and bowling alleys, which is interesting choice in terms of opening things up because other states are opening up first doctor's offices and dentists, but never mind. Georgia didn't use the gating criteria. We don't have a downward trajectory of cases. So not every state is going to go by this. These are just suggested guidelines from the White House. So I think because not every state is going to use these guidelines, it really puts more onus on employers to start thinking about what they're going to do and how they're going to think through this. So let's talk a little bit about that on the next slide. How do employers sort through all of this? And what I'd like to say is, many employers have had essential workers in the workplace throughout this pandemic. And I really want to take a moment to thank anyone on this call who's an essential worker. You know, all those who are on the front line in healthcare, emergency response, public service, those that are keeping the supply chains moving for food and medication, grocery store workers, postal and delivery service, and many others, because you all are on the front line of this battle every day. And can't stress enough how much appreciation the rest of us have for what you've been doing. So in terms of timing, it's going to be dependent on the virus and the epidemiology, and that should drive state and local government stay-at-home orders. Obviously, no one can do anything until those orders are lifted, but once they're other than essential workers, once they're lifted, employers are going to have to consider whether schools and daycares are open. For example, several states in the Northeast have closed schools for the rest of the school year, and so if they're closed, childcare is not available. It's going to be difficult for certain workers to return to the workplace. So as protocols and plans are put in place, that's going to have to be considered. From there, we kind of recommend employers use a data and evidence-based approach to design a return to the workplace. And what does that really mean? So we know certain populations are at higher risk of contracting COVID-19, including those over 65 and those with chronic disease. So we've developed some analytics and heat maps to help our clients who are multi-center show which locations have populations at greater risk and help them prioritize sites and timing for return to work. And then also looking at the functions for non-essential workers, trying to prioritize which functions are kind of more important to have back in the office. And then the next step is sort of establishing those protocols for return to the workplace. Right now, there are a number of vendors, including on-site clinic vendors, biometric screening vendors, and others that are putting together return to work packages. And these include anything from questionnaires about symptoms and history and exposures, temperature taking, and then testing, both for COVID-19 and for antibodies. And so what's the best practice and how should employers sort through these? Something that we're deeply engaged in is vetting these vendors and their algorithms from a clinical point of view to be able to advise our clients on the strengths and opportunities of the approaches. But a key element of the return to workplace process will be clear and often communication with the workforce about whatever protocols you're putting in place to protect their health and how the plan will be executed. Each employer is going to need to have a strategy, a roadmap, and a written plan specific to their industry, workforce, geography, and functions regarding how to repopulate. Specific issues to consider are going to be on a local basis, how employees get to work, whether they use public transportation, whether the office buildings or facilities that workers are in have their own protocols. So as an employer, you may have your protocol, but if your landlord has a different one, you'll need to reconcile that. And of course, the plan needs to be evidence-based using guidelines from CDC, the White House, those are more higher level, but they do have 3 steps for employers within those guidelines that I showed a minute ago. And other nationally recognized organizations also have guidelines. But this is, as Tony mentioned, this situation is fluid and the science and the information is literally changing on an hourly basis. So everybody's going to need to be flexible. The plan that you put together today may not apply tomorrow. So keeping on top of guidelines, new developments on testing and what the testing means is going to be more critical than ever. I want to note emotional health, which is really more important than ever. A lot of employers have been intensely interested in behavioral health even before this started. And now with people sheltering at home, there are a lot of issues regarding loneliness, being able to work at home with kids, the stress, but also domestic violence has increased. Addictions are rearing their ugly heads. Many people are dealing with difficult economic situations in addition to fear and anxiety that comes with a pandemic. So behavioral health considerations are going to be key as people return to the workplace. Some people are going to have PTSD. When Wuhan opened up a couple of weeks ago, you saw all the partying on TV and people out, but there were some people who wouldn't leave their houses because they had PTSD. So you're going to be dealing with people who have depression, loss of income. They may have lost a family member or a friend to COVID-19, or they may have had COVID-19 and be recovering from being physically ill. So there are going to be a lot of important things to pay attention to in terms of behavioral health strategy and providing resources and support. A variety of health and well-being vendors are now offering free or discounted direct-to-consumer apps or programs for meditation, yoga, and workouts. And I'll give you a link at the end of this where we have a lot of free resources, which you're more than welcome to hit our website and use, that have these discounted apps. We've also got a flyer on grocery and drug delivery. And please do share these because we'd like to help as many people as we can. Okay, let's talk a little bit about what happens when people get back into the workplace and what the risk mitigation interventions will look like. So many of these measures are similar to those that were used at the beginning of the pandemic. Some of these may require modification of workplaces and workspaces. For example, social distancing is recommended when people go back into the workforce. So people need to stay 6 feet apart. That may necessitate moving workstations or reconfiguring the office, or it may actually mean that you have to stagger people. So you may have some employees that are working Monday, Wednesday, Friday in the office and then work at home the rest of the week. Some work Tuesday, Thursday, or some work half days at home or at work so that you don't have that density of people if you can't reconfigure the workspace. Other important measures are going to include having hand sanitizer, wipes available, and cleansers. And as the workplace is repopulated, stress is going to mount, as we mentioned, and employers are going to need to guard against stigma related to those that have been infected previously or particular ethnic groups. You're going to have to deal with limiting visitors to the workplace. When this all started, we had many employers who just totally cut off visitors. So that's going to need to be decided whether you let visitors in, how you let visitors in, what kind of screening they'll have. Group meetings may need to be changed. Events may need to be canceled. I know Facebook, I think, has canceled any events over 50 people through the middle of 2021. Little things like what will happen to lunchtime. So restaurants may be closed. Number of people who can go into break rooms might be limited. So hopefully takeout will be available to support local economies, but more people than previously may be bringing their lunches to work. Some of the things that we have thought about for our own teammates, we're going to think about providing lunch boxes and recipes for bring your lunch to work, just little things to make people feel more supported. And then, of course, a new addition, as you see here, is that people may be wearing face masks in the workplace. And clothing manufacturers are already starting to have a heyday making fashionable face masks. So hopefully for women, that means we can wear less makeup, and that'll be a silver lining to face masks. But each employer is going to have to decide who's going to wear face masks, and if they're going to require face masks, whether they're going to provide those face masks. So there's a lot of decision points here. So I'll end on a positive note. Here's the good news on the next slide, which is that we're all soldiers in this war against the invisible enemy, COVID-19. It's not a battle being fought in some far off land. It's here at our doorstep every day. Each one of us has the power to beat COVID-19 by doing our part. So please wash your hands frequently and use hand sanitizer, practice social distancing, stand at least 6 feet from others at the grocery store or when you're out walking or running. Stay at home except if you are an essential employee reporting to work or you need to get essentials. And thank you again to all those who are essential, who are working or who have companies with essential workers on the front line. We're all on the line of this battle every day. And the last way to win this war is to be kind to others. This is an enormously difficult and stressful situation. We are all in it together. And I hope that we all come out of it safe and healthy. So thank you for your attention. And I'm going to turn it back over to Tony now.
Thank you very much, Dr. Short. That was incredibly insightful. I really enjoyed hearing the part about the healthcare system ramping up its capacity and the potential second wave. And then about the testing and antibodies, there was a lot to think about.
Yeah, Tony, I'm sorry.
Turn the floor over.
Sorry, I was just going to say I missed the last two slides, which we'll distribute, but there are resources there and links for people that they can go out and get a lot more information. It's open to everybody.
Yeah, yeah. I'm certain we could have talked for 2 hours on this topic and still not gotten all the way down to the bottom of the iceberg. But thank you very much. At this time, I'm going to turn the airways over to Dr. Eiler. It's all yours.
Thanks, Tony, and thanks everybody for coming on today, and hopefully everybody's safe and healthy, and thanks to all the essential workers as well. Dr. Short had a great presentation before this. Next slide, please. So folks, the agenda today with me is to basically tell you the economic situation as I see it and the effects of COVID-19 on California specifically, but also talking about the US economy and where California may go from here in terms of potential timelines and scenarios for the downturn to subside and trough, and then ultimately the economy to reemerge and get back toward the baseline. The other piece of that is what industries are likely to be the first in, potentially last out, and then I'll talk about some considerations for the labor market going into 2020 and beyond, which have a lot of different aspects, and Dr. Short alluded to some of these. I'm going to give you a little bit more of an economist angle on that, but at the end of the day, we should actually expect some opportunities out of this, believe it or not. Next slide, please. So real quick, and Dr. Short talked about this, this is one way of looking at the total cases through April 20 US. And the reason why this is important is that there's some evolution here. You can see that the increase started on March 1 and has been creeping up ever since, but it initially was rising at an increasing rate and is now rising at a decreasing rate and waiting to top off. And that's the key, is that for most of the political and economic decisions to be made, we need the caseload to start topping off and ultimately start going down the other side of the hill. And it's a tricky part of this is that epidemiology, as Dr. Short said, has become this like huge growth area, probably for ultimately a lot of kids to go into it later in life as well. But we're all kind of watching the cases, and unfortunately, this is the one thing, as I'll allude to in a second, is driving everything else in our economy for the time being. Next slide, please. One of the immediate effects of the caseload rising and rising in ways that we did not expect was the downturn in our equity markets. And so I wanted to show you a brief history of the equity markets, looking at the S&P 500 from January 2000 to April 2020, to show you the evolution of how things have gone in the last two recessions. So you'll see on the far left-hand side, there's two shaded areas. The far left-hand side is the so-called dot-com recession, where we saw the S&P 500 drop pretty significantly as a percentage of the market. And you can see that long slide down to the bottom sometime around 2003, and then we had pretty good strength back up to right about where we were at the end of the 1990s, then a steep drop in the Great Recession, which is the middle shaded area, down to a bottom of about 735 on a monthly average. And then we've been in this amazing bull market ever since. Well, that bull market ended, at least in its current stage, on March 1, 2020, and you see a 1 month sharp decline, which is somewhat unprecedented in our equity market history. But this started a lot of consternation in our economy about where investors saw things going, where business profitability was going to go, and ultimately where jobs were going to go. And that's the one thing that's driving a lot of concern still, is how deep unemployment is going to affect our economy and what sort of, let's say, domino effect that's going to have on business closures and ultimately even more job loss. That's why the markets lost a lot of value, but have been slowly climbing back up in April, which some economists are a little bit dubious about that change and whether or not we'll actually see the so-called bottom tested again. But that outlined area on the far right is how crazy things have been basically since March 1. Next slide, please. The next slide is somewhat cloudy to look at, but the main thing is the following. A lot of industries, in terms of the average hours worked, and this is from March 2007 on a monthly basis to March 2020, you can see that moving along. And basically all these industries kind of follow a lead of the US overall, meaning that while some industries go up and down, they're basically around 34 to 36 hours a week on average, where at the end of this, as you see on the far right-hand side, you'll see a steep drop. Well, that steep drop is in hotels and restaurants. So the reason I show this graph is because of the indicators that economists are watching, one of them being average hours worked. We're looking at this because we want to see what industries may be entering this issue first. And we kind of assume that hotels and restaurants were going to be the first in, and whether or not they are not the first out. That'll be something to watch very closely, but the hours otherwise have not contracted really in any other industry except for hotels and restaurants, and you can see that sharp decline on the far right-hand side. And we know that those businesses are suffering. The National Restaurant Association announced earlier this week that over 110,000 restaurants have closed in the United States. And think about that for a minute. We're not talking about chains. We're talking about a lot of local restaurants that have closed that are members of the National Restaurant Association, because if a chain closes, you're going to hear about that in the news. But those 110,000 restaurants have been somewhat under the radar because generally they're smaller. So that change in average hours worked is an indicator of potential unemployment and ultimately of potential business closure by industry. Next slide, please. Another major indicator we're watching on the labor market side is the new claims for unemployment insurance. And this is on a quarterly average because 1 or 2 weeks should not dictate a trend. And even though you can see on the far right-hand side of this, there's been an amazing change upward in the negative direction, because this is sort of in a negative scale. When these data go up, it's a problem for the economy. And you can see that by the 3 shaded recessions since 1986, that there was a climb in both US and California new unemployment insurance claims, and a recession was declared somewhere in the middle of that climb in most of the recession cases, except for the so-called Great Recession, where it came a little later, or it came sort of more coincidentally. But the bottom line is this, is that we've seen such a sharp incline or uptick in new unemployment insurance claims. We know unemployment is going to surge. The latest unemployment data for California and for the United States have not reflected this climb yet, because the cutoff date for those data are in mid-March. So while we started to see unemployment insurance claims that were new climb a little bit in March, the big numbers are coming in April in terms of unemployment and the number of people that don't have a job anymore based on these claims. Next slide. So the real key here, folks, is the depth and duration, and what policy is trying to do in terms of congressional policy and also policy coming out of the Federal Reserve is trying to offset the effects of social policy on our economy. Next slide. You can see here that the depth and duration is really being affected by social policy, the negative being bigger than the sum of the other policy pieces. And those policy pieces will get bigger once the social policy fades, because while we've had interest rates fall steeply and really down to what we call a zero lower bound, and we've had an enormous amount of fiscal policy, meaning Congress moving money through multiple channels onto the street, we are not going to see the full effect of that until the social policy contracts. And the reason is because consumers can't get back to consuming in their normal lives. We don't know how many people are going to have a job or not, which can affect consumption and also affect business spending behavior. The two of those, the sum of those parts is about 85% of our economy. So if those are contracted based on the social policy, other policies that are meant to boost the economy back up may not actuate those changes in a positive manner until sometime later in the year. And this has been one of the biggest concerns in terms of the so-called depth and duration of this episode, is will the monetary and fiscal changes we've seen in a drastically short amount of time, will they have the positive effect we're expecting at once the social policy ends? And if you go back a few slides and think about what I talked about with the equity markets, the reason why we're seeing somewhat of a bounce back in April is because we're expecting the monetary and fiscal policy pieces to support a positive outlook going forward once the social policy contracts. So there is good news out there, assuming monetary and fiscal policy have their normal historic effects on our economy, because they are in volume some of the biggest packages we've seen in history. Next slide, please. So to break down a little bit on the fiscal policy piece and the stimulus, if you are in HR or you are an employer, or you receive some of these checks, a lot of it is really focused on 2 major items. One is to keep businesses in business and workers in their jobs, or to support incomes for workers who lost their job. Either way, to keep the consumption of business and consumers together once the social policy is lifted. So we've seen extensions and an enormous array of expansion in terms of unemployment insurance. We've seen business loans come out, and this has been one of the biggest headlines about the so-called payroll protection plan money, where you can take a loan and it will turn into a grant on June 30, and the money ran out because it was so popular, and now a new tranche has come out of Congress. So we're watching that very closely, because we're hoping that in a sense, the theoretical aspects of why that money came forward will actuate themselves in a way to keep businesses from closing and keep workers in their jobs just in time for the social policy to contract enough for states and the federal government to release people back out of shelter in place and get back to their lives. The public sector is also receiving billions of dollars. And when we think about this, our public sector is likely to have a long shadow over it because of this episode, based on either an increase in expenses where people are asking for more social services and engaging more with local governments as a result of this, but also the loss of tax revenues because we're not consuming as much. So public sector might get a double pinch here that from a labor standpoint may lead to a lot of dynamics that we don't have time today to go in too deep, but I might talk about later in the Q&A. Next slide, please. So to think about how this all kind of links together, this is the unemployment rate in California and the US, where California is the black line and the US is the red since 1976, basically through February 2020. And the reason I'm showing you this is to show you the basic history around how we move through these crises and how the national and the state in California are offset from each other in terms of their dynamics historically. You can see the last three recession episodes, the Gulf War I, the dot-com, and the Great Recession are the three to the right shaded areas, and you can see the unemployment peaks sometime after the declared recession has ended. And that's classic. You kind of get through the recession, businesses sort themselves out, they rehire, and we go on to a better tomorrow. Next slide, please. Why that's important is that I now want to link together the unemployment insurance claims idea, because those should be a precursor to people becoming unemployed, and the unemployment rate. So the black line here is the annual evolution and percentage change of new unemployment insurance claims. And then the blue line is the unemployment rate in California. And you can see that from peak to peak in California, those last three recessions, which are focal recessions, just thinking about history, are 20 to 24 months apart from when unemployment insurance claims that are new peak, meaning people stop at the same rate going to get unemployment insurance, to the time in which jobs are sort of turn the corner and rehiring begins in net and in earnest in our economy, assuming that the recession ends and we don't see a longer duration. So this also gives you a sense of the depth and the duration of the three previous recession episodes. But that's why economists are really struggling to find good indicators, because the data have not shown their face yet. And unemployment insurance claims are the one data point that have at least shown up and provide us some historic link to the dynamics that may follow. Next slide, please. So to start wrapping up, I'm going to show you two scenarios. One is a tricky scenario, meaning that we are now expecting to have some declared recession in 2020. The depth and duration of that recession is the big question mark. If we have, and we've taken on similar dynamics as China did initially, will we have a short recession where some workers are furloughed, some were laid off, and then maybe rehired relatively quickly, maybe around the end of Q3 and into Q4, because the social policy contracts, people slowly get back to work in this sort of evolving window of industries that are allowed to go back socially and make adjustments in terms of its extra cost to get back to work safely. And ultimately, and this is the key, that last bullet, we don't create capacity loss. One of the biggest concerns for economists is a loss of productive capacity in the economy, because businesses actually contract in such a way that even if consumers want to spend money, businesses are going to think twice about rehiring because of risks. And that then leads us to the more ugly scenario. And Dr. Short alluded to this possibility. In the ugly scenario, the situation starts to generalize itself, meaning no industry is really left untouched. Even our essential industries right now might still see problems because of either shifting consumption dynamics once social policies are lifted, and we may slow down what we're doing at the grocery store, which might help restaurants that are still in business, and may slow down groceries or grocery demand. Those kind of dynamics are still to play out. Even in healthcare, we're not 100% sure that there's going to be positive dynamics throughout this episode and beyond, because we may see some healthcare services actually not choose to stay in business based on lack of demand right now. So the ugly scenario means the restart is slow. Air travel and tourism are slow to rebound. And if we have a slow rebound in California all the way through the tourism season, it is going to get pretty nasty this year for a lot of businesses in California, because the economic impacts of tourism are so widespread in California in terms of our core industries being able to support other ones that are tangentially related. We need to watch for that. And then really 2021 is when we start to hopefully see a turnaround, assuming we don't have a repeat. And my ugly scenario actually has a slight repeat involved. So now let's take the next slide and you can see where we're at here. I happen to be on a forecasting group with the California Department of Finance, and this is basically where that group is landing in certain ways around a forecast going forward to try to get back to the baseline. The black line, which you can just see a sliver of it on the right-hand side, was the original baseline forecast for California. The tricky scenario is in blue, where we have a sharp downturn, not too deep, but sharp enough to where it hurts. and then we have the slow climb back up, and we're back at the baseline about 2022. In the ugly scenario, we have a sharper downturn, the depth is deeper, and we actually extend that depth because we have a second episode that slows down business investment and rehiring, and it might take us to 2023. The black arrow shows you where if we're in the ugly scenario, that we've actually lost all the job growth almost for 5 years. So California is sort of blasted back to where it was 5 years ago in terms of total employment in the ugly scenario. And folks, the unemployment data that are going to come out the next few weeks are going to seem like that's where we're headed, and going to seem a lot like the shaded area that's outlined in the Great Recession, where we saw jobs go down very quickly. Last slide. So in terms of considerations, think about changing workplace, the way we use our spaces and how that might affect rehiring. Government workers choosing to retire and making choices that might affect pension systems and a lot of other aspects of public budgets, and how that might change the dynamics of how government works. But on the positive side, the fourth consideration concerning labor is we may actually see some entrepreneurship on the other side of this, not only in the healthcare side, but also in the way we work and the way we live, in such a way that we're going to see some amazing economic dynamics in the next few years and potentially by the middle of this decade. But there's going to be change, and how structural that change is still remains to be seen, but we should expect it. Some of the things we're going to watch here as far as indicators: new claims for unemployment insurance, that will dictate how many people actually lose a job more or less. Whether or not those dynamics change because of the federal policies, both from the Federal Reserve and changing interest rates and giving businesses and consumers a reason to buy again, and also this array of loans and expanded unemployment insurance, remains to be seen in terms of people morphing back into their jobs. We don't know that yet for sure, but we're going to watch those employment dynamics and the average hours worked to hopefully shape the evolution and forecast correctly. The epidemiology is going to be dictating most of it. The social policy needs to contract before anything else happens. And we're hoping, and this is the last point, from an economic standpoint, we don't want to exacerbate the downturn, because our urban and suburban areas start to feel social unrest as people see the weather get better. For example, in California this week and next week, the weather's supposed to be basically spring-like and spectacular. Will that start to affect the social cost of this issue and potentially exacerbate the way we're going to get out of this with respect to the cost to society? So that's all I have. Thank you so much again for having me here today, and I'm looking forward to the Q&A.
Thank you very much, Dr. Eiler. I appreciate your perspective on the numbers and the trends, and you can sign me up for the tricky scenario. You can save the ugly scenario for somebody else. Anyway, now we're going to move swiftly into our panel discussion, which is going to focus on answering questions we've received from many of the attendees for today's webinar and from some of our other clients. And as mentioned earlier, you can use the chat function to ask questions. At this point, those will most likely be answered on the FAQ that we'll send a few days after this webinar. So keep an eye out for that. I'm going to dive right in with the first question. This is going to be directed to Melanie Weiss. Melanie, are there any centralized resources providing standardized information on these topics we've covered today?
Thanks, Tony. Great question. If anyone out there knows of one for sure, please send them our way. One thing that we've seen is that there's many associations and law firms that are providing guidance on these ever-changing regulations, sometimes even up to an hour. We're seeing things change. I'm sure many of you are laughing with me right now, especially those in HR. What I would suggest is just staying connected to resources such as SHRM, the EDD, the Department of Industrial Relations. Your county sites are really helpful because those give you information on the quarantine orders in your locale. Also, your industry-specific chapter is going to be a great place for you to visit. Frequently review all of these sites' COVID-19 resource pages for updated information. Here at Nelson, how we're staying on top of these regulations and resources is we just go to those sites daily. We're looking at them. We're staying connected to our council. We're staying connected to all of the local government sites and combing through their COVID-19 pages on a regular basis. For us here at Nelson, our local industry association is American Staffing Association, so we're also staying connected to them as well.
Great, thank you very much. Dr. Short, I'm going to send this second question your way. how will COVID-19 impact healthcare plans? And if there are increases, who will pay for the increases?
Yeah, so that's a great question, and it's not an easy answer. A couple of points. So, obviously, we are an employee benefits consulting firm, so we've been looking at this a lot in terms of employer cost. And we have a model that takes into account decreases, which we will see in inpatient, outpatient, elective surgeries, office visits. We expect prescriptions to go up, but our model kind of ranges from -10 in some of these buckets to -30, depending on how long the shelter in place lasts and the curve in terms of the virus. But we do expect that there will be a spike when these shelter in place orders come off and people are allowed to go back to elective procedures in dentist's office and things like that, that there'll be an increased demand and a peak. And we don't know when that will be. It could be different in different geographies. So we expect, decreases in some of these services. We don't know for how long and what the net impact would be. And then also that there may be increases because of COVID-19 testing and treatment, and where that all lands and how it balances out in terms of employer health plans is something that needs to be kind of sliced and diced on an individual employer basis. But those are some of the considerations in terms of looking at this. And I mean, employers, self-funded plans are definitely going to foot a lot of this bill. There's no question.
Thank you very much. Dr. Eiler, here's one for you. Are California households prepared for severe economic recession?
That's a great question. In terms of going into this situation, economically speaking, California households were in pretty good shape in that we'd seen savings go up, we'd seen incomes go up, wages rise. The equity markets had provided good returns, but not everybody participates in that. So the households that are probably least prepared are going to be our low-wage commuting households, where they may be only a couple of paychecks away from being, in a situation where they might not be able to stay in their home. So we're hoping that we find out that we had very few people leave their homes by force when this is said and done, because of the long, slow, and positive economic growth cycle we'd been in before this. So we're hypothesizing that's the case. The key, though, is again the depth and duration. If this episode is deep and mainly cuts at the low to medium wage scale and is long in duration, then really no household is safe regardless of how you came into this. But, and Tony, you alluded to this, if the tricky scenario takes place, it's probably way better, obviously, for most people, but it should protect some of those households from making marginal decisions about staying in their homes or staying in their cars or what have you. The ugly scenario is going to put almost everybody at risk.
I said I'll take tricky. Dr. Short, you touched on this in your presentation, so I think this is a good question for you. It says, what are your suggestions for helping employees manage the mental health and wellness issues arising from this pandemic?
Yeah, that's a really critical question. So a few points on that. One is, employers should look at the resources they have today. If you have an EAP, Employee Assistance Program, a lot of them are offering webinars and even chat groups that are a little bit like group therapy run by a social worker or a psychologist, where people can talk about, what's going on and get suggestions from other people on how to manage things. And any other behavioral health programs that might be accessed through a health plan. So making sure that all of the employees know how to access these resources. The second is there are a lot of free resources, as I said, yoga, meditation, behavioral health programs. And if you look on the links on our website, which if you go to the very last slide, if you want, that I had, that I kind of skipped over, there are links there. There's a free toolkit for anyone, and there are a lot of resources on there regarding behavioral health, how to deal with grief and things like that. Some of the tips I think are really important are to plan ahead, for people to kind of be able to have some regularity to their lives right now, because everybody kind of feels a little out of control. Make sure that people aren't isolated. Encourage them to have online coffee breaks or set them up through your company. I know we have like an online thing for our own teammates every week for half an hour where we do little games and things like that. But beyond that, just encouraging people to stay healthy, eat well, sleep well, not stay with the news cycle too much. I mean, you want to know what's going on, but it can drive you crazy. So to take breaks from that news cycle. And then also, I think what's really important, and we're hearing a lot from employers now about what do we do about the angry worker, someone who's been furloughed, or someone who's having tough economic times, or even someone who's essential, who's very scared. And so there are a bunch of tips that you can get on managing angry workers. We've got something on our website. They're EAP, and again, there are free resources, but that's going to be an issue that's going to come up more and more.
Thank you. Being a high conformist, I like this question that one of our clients asked. Are there rules about asking a candidate during an interview if they're able to work from home? Melanie, I think this one's tailor-made for you.
Thanks, Tony. Yeah, so at-home work arrangements, they've been in play for a while now. This just becomes a lot more relevant with COVID-19. So we're seeing more businesses extending at-home work arrangements in the quarantine that may not have done so in the past. Some important things to know: it's not illegal to ask if they can work from home. If that position becomes classified as work from home, the one thing we don't want to forget is understanding if people can perform their duties with or without a reasonable accommodation, just as you would with an in-house candidate. When we're speaking about that, it's not necessarily so much around equipment. It's more about can they perform? What do they need? Are there any accommodations that might need to be made in the sense of maybe headsets that you would have provided, keyboards in the past? So really getting to know some of those items and considering those folks that already have an accommodation when they were in the office.
What about those that are working from home now? and throwing you a curveball here. And when we reopen, those jobs are deemed to be in an office and that they can't work from home any longer, those that want to keep working from home.
Yeah, such a great question that I know many employers are looking at right now and trying to understand their approach on that. I think those are going to be very personal decisions for businesses to make. We certainly have realized how many roles can be done in the home and completed in a work from home environment. We've understood the challenges with that very intimately, very quickly. So again, I do believe that's a personal decision that each business will need to make, and some challenges that they may have if they do require their teams to go back into the office.
Yeah, I definitely think as an employer, it's a consideration that people should be thinking about. And I touched on, that's kind of touching on one of the questions I saw in the chat, by the way. All right, and then here's one for Dr. Eiler. How will the effects of this pandemic impact consumer confidence, and will people be willing to spend money before there is a vaccine?
Great question. We should expect a negative impact on consumer confidence in the short end, simply because people are going to be very concerned about their job savings and not eroding those savings quickly. And then really it's more about consumer confidence in the types of things they're going to buy. Are they going to be confident to buy groceries, which, just basic food to keep them alive? Or are they going to actually start buying cars because there's going to be an amazing amount of incentives to buy consumer durables once this is lifted? One of the things that a lot of those businesses are concerned about, are car manufacturers and appliance sellers are going to be worried about, is that we're just not going to do anything for a while and sit on our hands. So you're going to see some unbelievable deals come out, and then consumers are going to be tempted to do that. And the idea of it, whether or not they're going to be willing to do it before a vaccine comes into play. The problem with that is that we really need to try to restore consumer confidence in any case. So it is possible consumers will be very nervous if there is an open threat that continues toward the fall of a repeat, and that's going to definitely slow things down. And this is why that ugly scenario I showed you is possible, because there's this flick of the dominoes from reduced demand to reduced jobs to reduced businesses. And if those businesses go away and we can't rehire, that could lead to another round of job loss and another round of contracted demand that then will definitely hurt consumer confidence going into the fall. So you might see some real slow activity come out of this, unfortunately.
Dr. Short, how will telemedicine factor into healthcare moving forward?
That is so interesting. So this pandemic has changed the landscape for telemedicine. A lot of employers have telemedicine, either independent contracts with telemedicine companies or through their health plans, and a lot haven't been able to get traction for telemedicine. And now what we're seeing is utilization is up tremendously for telemedicine because a lot of doctors' offices, majority of them around the country, are closed. So what we've seen there's sort of two prongs to this: telemedicine vendors like the Teladoc, Doctor on Demand, all of those, they've got like 600% increase in utilization, both for COVID-19 screening and for other services that people just can't get now in bricks and mortar. But what's happened is a lot of bricks and mortar doctors that weren't doing telemedicine have jumped into it. And again, talking about economics, they are also, small businesses or maybe even larger businesses, but they're businesses. And so they've had to adapt and move to telemedicine and pivot very, very quickly. So we're seeing a lot of specialists even doing telemedicine now, like GI, which is a procedure-oriented specialty. They can't do procedures right now electively, but they can do telemedicine. So the landscape is changing, and it's really going to accelerate how we use virtual care in general. Telemedicine vendors are growing their networks, and what we're seeing are changes also in terms of legislation for telemedicine. So previously, telemedicine physicians weren't allowed to cross state lines. Now at least 8 states have loosened that up to cross state lines. And I think what we're going to see in the future is just a huge shift to virtual care. And with that is going to come a lot of innovation in terms of monitoring patients at home. And we're going to also see much more primary care done virtually, whereas we're more seeing sort of like subacute care done virtually. And it's also going to change the cost of care. It may bring down the cost of care, but what we have to be careful of is that physicians still get reimbursed at a reasonable level. Otherwise, we're going to have a problem. We already have a shortage of primary care physicians, and we'll have a bigger shortage if the reimbursement doesn't even out to what people are getting today.
Thank you very much. It's going to be fun for the practice management firms.
Oh, yeah.
Having come from the healthcare industry myself. Let's see, Melanie, I'm going to have you answer this question. Has unemployment insurance changed under COVID-19? Are there any changes to benefits or impacts to employees' salaries?
Yes. Great question. There have been recent changes in light of the COVID-19 issues and EDD, Employment Development, has extended some benefits. Those items are: the governor has waived that 1-week unpaid waiting time for any COVID-19 related unemployment and disability insurance claim. They are requiring some documentation on that, so I'll talk just a little bit about that. Those who can't work due to having or being exposed to COVID-19 are filed for disability insurance. At first, we weren't sure how the EDD was going to handle that, but they have now published on their website that a doctor's note will be required to support any of those claims. Paid family leave as well may be available to those caring for an ill or quarantined family member. That benefit typically provides up to about 6 weeks of benefits. However, starting July 1, 2020, this will be extended to 8 weeks. Also, benefits may be available to those who have lost childcare. The EDD will determine eligibility on a case-by-case basis. So, and then one of the other items that's really important to mention is starting week ending April 11th, 2020, and up through July 31, 2020, the EDD is going to begin paying an additional $600 on top of that weekly award amount. I know many HR folks, as well as ourselves, are probably getting a lot of questions from your employees about self-quarantine. What we've been referring our employees to is just say, hey, the EDD will be making those decisions, and those are a little bit out of our hands. For anyone wanting to reference this, the EDD has a very comprehensive COVID-19 response page. It addresses a lot of questions on both the employee, employer, and how to go ahead and file. So check that site out.
Great, thank you, Melanie. So out of respect for everybody's time, I'm gonna just bring this to a close because there's some things just for the attendees to be aware of that are gonna be coming their way that I think will be helpful and will add value to today's program. So thank you, first of all, to our panelists, Dr. Louise Short, Dr. Robert Eiler, and Melanie Wise, for sharing your expertise with us today. Really grateful for your time. I also want to thank our marketing team for pulling this together, because it's first for me being part of a remote type webinar where we're all in probably 7 different locations right now. But I want you all to be on the lookout for an email with a link to download the PDF for the slides and the video recordings of today's webinar. Also, keep your eyes open, most likely in a separate communication, the FAQ for those questions that we didn't get to, because there were 17 that we had prepared to cover today, and we got through a little bit more than half of those. And then also those that are on the chat, we'll make certain they get answered. We want to help you with those resources. And then the final thing that's very important that you'll be receiving is a post-webinar survey. We want your feedback. It's important for us. It helps us shape the future events so that they're meaningful for you. And just want to say I'm proud to work with Nelson. Over my tenure with them, it's just been coming from a publicly traded company to this family-owned company, the way they care about the communities they work in. We care about the communities we work in, and the dedication to having programs like this has always been in the front of our minds. And I'm glad we were able to pull this off today. And I thank you, everybody, for attending. I want you to stay safe, be healthy, and I wish you and your family all the best. Thank you so much for attending today, everybody. Have a great day.